health is well-being of physical, mental and spiritual health. When a person is having a good physical health, he is able to function very successfully, actively, productively, without having pains, discomforts, tiredness and failures, etc. Then he will be a very successful and productive person. Infections, growths, deformities, physiological and pathological changes and some more influence the physical health, and then people will get different types of disorders. When they get different types of disorders, they seek treatment. When a person is having a good mental or psychological health, he will be able to build up affectionate relationship with the others. Then he will be able to understand the others' emotions. He can respect the others very successfully. He is free from stress. He is able to manage his life events and conflicts successfully. He will be a creative person. He enjoys good physical health. He has good self-confidence and self-esteem. And he is having very high successful personal life. Different reasons are involving for the well-being of mental health. Some of them are different types of thoughts, life events, others' behaviors, habits, physical illnesses, so on. Because of these influences, people may get lot of psychological changes in the psychological state, functions and behavior. Then different types of physical symptoms can be developed within their body. Some of them are palpitation, tremors, lifeless feelings, sweatings, faintish attacks, shivering, headaches, heaviness of head, dryness of mouth, pain in the body without having any physical base. These changes and symptoms may lead to get some physical disorders. If they feel these disorders for a long time, they will get different types of physical disorders, just like heart diseases, gastritis, then respiratory diseases, so on. Finally, people will get lot of psychological disorders or illnesses. Then they will lose lot of life events, cognitive functions, so on. All these lead to get different types of psychological and psychiatric disorders. Just like the physical illnesses or disorders, mental disorders are having treatments. These treatments can be divided into two parts. One thing is physical treatment. Example, drugs and ECT. The other one is the psychological treatment. These psychological treatments are completely free from drugs and completely free from other physical treatments. Psychological treatment consists of treatment methods, treatment approaches and rehabilitation techniques. All these things are based on psychopathology, psychological theories, psychological research results. Before implementing the psychological treatments, it is very important to follow the following. First one is psychological assessment. This psychological assessment will help to analyze the person's psychological state, psychological behavior, and in the same time, under this psychological assessment, the professional or the person who is implementing psychological treatment are trying to find out the patient's past psychological history, physical history, personal history, family history, educational level, marital problems, social history, so on. Then next step is the psychodiagnosis. At that time, the professional or professional person will be able to come to the diagnosis regarding the patient's illness. So then the knowledge of treatment, the knowledge of psychiatry, knowledge of assessment will help to come to the diagnosis with the help of ICD and DSM classification. Then the person is able to plan the psychological treatments. Then he is able to implement them according to the plan. So then then the first step of implementation is to give some form of education and awareness about the person's illness by using psychological education or psychoeducation, and with the help of assessment. Then the patient will get some awareness about his illness, as well as he will be able to build up some confidence toward the psychological treatment. All these things are highly important. After that, only the person will be able to get psychological treatments to cure or manage the illnesses. Some of the psychological disorders, just like stress, anxiety, generalized anxiety disorders, obsessive compulsive disorder, post-traumatic stress disorder, phobias, depression, panic disorders, adjustment disorders, convulsion disorders, somatoform disorders, especially hypochondriasis, personal disorders, eating disorders, sleep disorders, sexual disorders, children's education and behavioral disorders, family, social, domestic, marital and employment problems, personal disorders, habits and addiction are more suitable to follow this psychological treatment. In the other way, psychological rehabilitation can be used to treat schizophrenia and psychotic illnesses. It is very important to exclude the patient's physical state, physical symptoms before implementing the psychological treatments. We will discuss more about the treatments which are suitable for different psychological disorders in future. Thank you.